Okay, good afternoon, everybody. Welcome to Oldham Locality's Primary Care Commissioning Committee. We'll do a round of introductions and just to confirm that we are quorate this afternoon. So I'm Nicola Hepburn. I'm the Deputy Place Lead for Oldham Locality. Kate.
Hi, Kate Rigdon, Associate Director of Finance, NHSGM, Oldham Locality.
Thanks. Erin.
Hi, Erin Portsmouth, Associate Director of Strategy Planning and Development, also NHSGM, Oldham Locality.
Thanks. Kath.
Afternoon, I'm Kath Madison, Head of Complex Care and Personalisation, Oldham Locality, GMICB.
Thanks. Marion.
Hello, Marion Colohan, Head of Primary Care, GMIC, Oldham Locality.
And Sharon.
Hello, I'm Sharon Butterworth. I'm PA to Kate Rigdon and I'll be taking the minutes this afternoon.
That's wonderful. Thanks. So just to confirm, we are quorate. We've had apologies from Mike Barker, Place Lead. I'm therefore chairing this afternoon, and Dr. John Patterson, who is a non-voting member, but our Associate Medical Director for Oldham Locality, to give clinical assurance and feedback into the committee. We don't have any other members currently present, and we've got nobody joining us. So this is being live streamed and can be rewatched afterwards. So we'll go into the agenda. We've noted apologies and we've done introductions, declarations of interest, noting that they are on the current register, but if anybody does have any conflicts as it's arisen during this meeting, if you can raise your hand and let me know. Moving on to minutes from previous meeting that was held back in February. Not going to go line by line. I'm assuming they're taken as read, and if there are any comments or amends, please let me know. Okay, lovely. They're taken as read. And then moving into the action logs and matters arising. So there's one action outstanding, Marion, which was from February, new type of report to be provided at the next meeting to include GP numbers, appointments and trends. Is this something that's ready now, or can you feedback on that? Thanks.
No, Chair, the current data hasn't been updated, so we're waiting for the national data set to be published. So as soon as that is, we'll be able to report back to the committee.
That's lovely, thanks. Sharon, if you can note that as updated, we'll review it at the next committee. If it's not available, we can close and then just bring back Marion as required, if that's okay. Okay. No other actions noted. So moving on to the agenda, and this the SAS item is for approval. So if everybody can note that as Marion takes us through. Marion, over to you.
Thank you, Nicola. So the purpose of this paper is to seek ratification of the terms of reference for the Oldham Locality SAS appeal panel and the Oldham Locality immediate patient removal process. As the committee will be aware, the special allocation scheme is a nationally directed enhanced service commissioned at locality level in each locality of Greater Manchester. And that scheme provides essential primary care medical services for patients who have been immediately removed from their practice list due to a result of an actual act of violence or threatened violence or behaviour in such a way that practice staff or others have feared for their safety. We have two practices in Oldham who currently provide the SAS scheme, and in terms of that provision, and the process that practices have to follow, we are fully compliant as a locality. We have recently had an appeal against a removal, and therefore that caused us to need to review our process in respect of hearing those appeals against an immediate removal from a practice list. And it is this process that we're asking the committee to ratify today. If you could move to page 24 of the combined papers, the terms of reference for the Special Allocation Scheme Appeals Panel are included. This panel will hear any appeals from patients who have been removed from the practice list. All duties and responsibilities will be carried out in line with the national contract and the policy and guidance manual for general practice, and the meetings would be convened as and when necessary, rather than held on a monthly basis, because the group would only be needed in the event of an appeal, which doesn't happen very often, hence the need for this process to be considered and refreshed. Does anybody have any questions? I recognise the committee will have read the papers in respect to the proposed process.
Don't think so. I suppose it's just for noting, Marion, is around the escalation back then up into the governance around the GM Primary Care Commissioning Committee, any agreements with all of that, because the overarching review of all of that governance is something that we're working through now. We're working under the GMICB. I think what we've got covers, so I'm supportive of that. I think it's just the wider conversation as we start to work through, and it would be useful the next time, if we do get another appeal, that we bring that back round to make sure that that process it runs smoothly up through the GM ICB Primary Care Commissioning Committee. Erin.
Yes. Sorry, I know you asked if there were any questions, and I shook my head, but I suddenly thought, if Sharon, if you can note this as an action for me, I will share this with our leads doing complaints for Oldham, albeit obviously they will start working under more of a GM banner as well, but we still obviously get local queries and support through the patient advice liaison. So I'll just, if we can note that as an action for me, I'll make sure that's shared with our complaints colleagues.
Thanks, Erin. Any other questions for Marion before we move to approval or not? No. Okay, so by going round, is this taken as approved and supported by the rest of the committee? Kate, yes. Yep. Erin, yes. Kath, yes. Marion is supportive of this paper given you presented and the recommendations. Okay, so Sharon, noting that this has been approved, the action noted by Erin, we can move on to the next item agenda, which is the Primary Care Quality Improvement Scheme. This is for information, questions and feedback. Marion, over to you.
Thank you. The committee will remember that in February 2023, we presented high-level principles for our 23-24 locally commissioned service, and the committee agreed that we should move forward and progress this scheme. So this is to provide an update to the committee on progress to date. Firstly, I'd like to say thank you to all the practices in Oldham that attended the practice engagement session last week, and indeed to all the practices who have requested individual conversations with the primary care team about this year's scheme, because their consultation and input is highly valued and is indeed improving the scheme and turning it into something that is fit for purpose and will deliver quality improvements, we hope, for the Oldham population. Okay, so in respect of an update and where we are now, the scheme contains qualifying criteria this year around prescribing, shared care and frailty, and that is demonstrating compliance with the frailty elements of the GP core contract. The baselines in respect to prescribing are yet to be established, so we will not be asking practices to be compliant with those by the end of June, but they will be asked to demonstrate a full year target. In respect of shared care and frailty and the register validation which is needed for the diabetes, respiratory and other frailty elements of the scheme proper, which will be launched on the 1st of July. We now have all the baseline searches and read codes and templates set up, as well as a Tableau dashboard and patient reports that all practices will be able to see on EMIS Enterprise. Those are going to be shared with every practice in Oldham by this Friday, the 5th of May, and that will allow all practices to check back that they are fully compliant with the qualifying criteria by the end of June. We are now progressing on the delivery phase of the scheme, which will be 1st of July to 31st of March. And we've made significant progress in respect of developing the indicators and related baseline reports from this stage of the scheme, which will be published and with practices by the end of May. So we've been working closely with our colleagues in data quality and business intelligence to promote those. As I said at the start, we've been undertaking a large programme of communication and engagement with practice managers and with GP partners, both through the Practice Managers Forum, through an all-practice meeting last week, and through individual practice visits as requested throughout Oldham. In respect of next steps, practices are now being encouraged to review their position against the qualifying criteria and take appropriate action as necessary. That baseline data, as I said, will be with everybody by the end of the week, with full scheme details and contracts published by the end of May. The process in respect of sign off with GM Integrated Care in respect of the contract waiver forms, Kate, and all is running concurrently. So we're working with the contract team at GMIC to take that process through. So far, we're delivering against the time scales.
Thanks, Marion.
Any questions or comments?
So I think, yes, you've noted, and I think, you know, a huge thank you. It's a busy time of year to all of the practices, but equally to you and the locality team. This is very much driving forward. We've heard what practices have said, we've heard the feedback, and we are now starting to deliver against the ask for us. I've got one question. Has anybody got any questions or feedback? Kate?
Yeah, thank you. So just recognising there's no financial information in the report, so obviously we need to request that for the final version to be approved. And just to confirm, as you say, that there is a process through which we need to follow NHSGM governance, and we're following that and we're compliant with that from a GM ICB perspective. So just for noting for the minutes that there is a concurrent process, as Marion outlined, that we need to follow with NHSGM. Thank you.
Thanks, Kate. So my question is more of a, how have those visits gone? So yes, we're hearing, yes, you've fed back into, yes, you're updating. Is it being received positively? Is there anything that's likely to tip you off the timescale and the expected delivery of go live around in July?
Okay, so I'll take the last question first. I think we haven't seen the full baseline data in respect of the 1st of July element of the scheme and the scheme proper. We still need to do the financial workup, as Kate has mentioned, and to set those thresholds for every practice. Whereas that is very doable within the time frame, there may be further consultation required with providers in Oldham about whether they feel those stretch targets are reasonable. I think everyone is accepting that as a quality improvement scheme, there will be stretch targets, but it's especially with the frailty element of the scheme, we're talking quite a big cohort of patients, and it's ensuring that what we build into the scheme, despite being a stretch, is reasonable and achievable, because we do want everybody to engage in this for the benefit of residents of Oldham. Okay, in respect of the comms and engagement and how that has been going with practices, the session last week was very well attended. Over 50% of Oldham practices have now requested a face-to-face meeting with a member of the primary care team, and we aim to have all of those completed by the end of next week. We have taken feedback and comments into account around concerns around cohort size and the prescribing indicators and challenges with the do not prescribe items on there. I think it's always difficult, but I think overall it is being well received. I think practices are happy to see a scheme where there will be clearly defined targets, and they'll be able to identify the interventions and the patients that they need to see quickly and easily.
Thank you. I think and if for nothing else, this shows as a locality we've heard some of the feedback of previous incentive schemes, and I think the comms and engagement to get us to this point so far, thank you, and to the practices. Any other comments on that? Okay, received. Thanks, Marion. Anything you need outside of the committee to help get us to that final point, noting Kate's request around the finances to get us over the line, that's, where to come if you need any more support. So thank you, noted for information. Item 7 on the agenda, the Enhanced Access Progress Report, again for information and for noting. Over to you, Marion.
Thank you. Sorry, I'll just find my notes. Okay, from the 1st of October 2022, as the committee was aware, PCNs have been required to provide enhanced access between the hours of 6:30 p.m. and 8 p.m. Monday to Friday and 9 a.m. to 5 p.m. on Saturdays. These are called the network standard hours, and this is in accordance with the requirements set out in the primary care network contract hours. The purpose of this report is to provide a summary of the service provision provided by each PCN and activity data for the period October 22 to March 2023, the first 6 months of delivery. Okay. So if we move to Oldham East PCM, Oldham East PCM subcontract provision in its entirety to IGP Care. In respect to their data, they're delivering approximately 56 hours of appointments every week, slightly less than the 57-hour target based on their population size. However, well within the tolerance levels set by Greater Manchester of 4%. The vast majority of their appointments are face-to-face, with 30% offered over the telephone. And this is in line with the pattern that you see in core general practice as well, where most services now have moved to a triage first offer. A lot of the appointments were routine and on the day. And the utilisation rate of all appointments offered in the 6-month period was 97%, so very high. Oldham South PCN have a mixed model of delivery where they subcontract some sessions to IGP Care and offer some in-house in their own GP practices. They've got a slightly higher rate of face-to-face at 84%, with 16% being delivered over the phone. And they have a broader range of staff, I think, providing these appointments: AMPs, nurses, HCAs and first contact practitioners, with a DNA rate of 8%. Oldham Central PCN has been slightly under on performance in respect of the number of appointments they have delivered. They are the only primary care network who delivers everything within the network standard hours. And their utilisation rate in the 6-month period, March to October, was 69%, with a very high DNA rate of 26%. They've been asked to validate this data as it is somewhat out of step with the DNA rates in the other primary care networks, and to consider their delivery model. Oldham North PCN has delivered The majority of their appointments in the network standard hours, with only 8% outside of them. 81% are face-to-face, and again they have quite a varied model in respect of different types of appointments being delivered by GPs, nurses, HCAs and phlebotomists. They only have a DNA rate of 3%. Milltown Alliance or Oldham West PCM are delivering 63% of their appointments within network standard hours and the rest outside. This was in response to a survey that they conducted of their practice populations, who specified that they would like some early morning appointments. So while they're providing those outside network standard hours, they were also outside GP core contract hours. They've got a high utilisation rate of 97% with a DNA rate of only 1%. So in conclusion, all PCNs mobilised the enhanced access service within their network on the 1st of October. As I said, only Oldham Central delivers the service exclusively within the network standard hours. 44% of all appointments have been acute or booked on the day, with 43% classed as routine or booked in advance. 2% of appointments have been planned clinics for patients with long-term conditions, and I think networks, as they develop this model further, plan to increase those and move away from what has been the majority of acute provision. And a further 9%, which is good to see, have been planned clinics for vaccinations and screening. Again, networks are planning to increase this. 77% of all appointments have been face-to-face, with 23% provided by phone. As I said, this is in line with how most general practice now operates, with a triage-first system. 3 PCNs overall, that's North, Milltown Alliance or West and South, have exceeded the average number of required weekly minutes in the 6 months from October to March 2022. Oldham East was a tiny bit under, but Oldham Central does have a significant shortfall in the number of hours that they need to provide. There is now a decision with GM Integrated Care around whether that money will be reclaimed or whether the primary care network will be offered the opportunity to deliver those hours in the next 3 months over and above the minutes that they have to provide anyway, because that in some ways would be to the benefit of patients and improving access. So we await a final decision from GM Integrated Care around that in the next week. There were some delivery issues across the PCNs in the first months of service provision that were beyond their control. We had some issues with PCNs being initially unable to use the premises that they wanted to do, so we had to work with the partnership to unlock those for them. And the IT issues have been challenging in respect, especially as in Oldham South, PCN and West, where you've got practice-based models with patients from different practices being seen in local sites rather than one centralised provider that is subcontracted to. So overall, it's been a really successful launch. 4 of our 5 networks are fully compliant with the minutes, and we will continue to work with them in the coming months to improve and diversify the service, both in respect of types of staff working in the enhanced access service and types of appointments offered. Thank you. Does anyone have any questions?
Resounding silence. So thanks, Marion. Received. I think there is a big decision to be made now around some localities and some PCNs where they are under the contracted minutes, and actually if they've not been able to deliver within that time, how do they meet the contracted value plus anything that has been carried over? And I know that that's certainly the conversation that's happening at a GM exec level to decide how best, so yes, to improve outcomes, but actually not put increased pressure on providers that are already feeling a significant level of pressure within the primary care arena. So I think we'll wait for that, and again continue to support all of our PCNs as we do locally to improve the access. So that's really positive. Thank you. So if there's no other questions or comments, thank you, Marion, for those last 3 agenda items. We move into any other business. I've not formally been noted, but we have time. So if anybody's got any other business they want to raise. We don't. Okay, so we then move into closing the meeting, and the next meeting is in June. So look forward to seeing everybody then. Thank you very much. We'll stop recording.